If you're actually serious about growing your dental sleep medicine practice, you have to stop acting like a dentist. Let me explain what I mean by that. Let's say you yourself go to your primary care physician and you have some shoulder pain, okay? And all that doctor does, the doctor doesn't say, okay, hey, we're gonna sign a financial agreement, we're gonna put a down payment on this, and here's how much it costs. They don't go through anything of that with you. They go into diagnosing, okay? Obviously, you as a dentist, you can't diagnose obstructive sleep apnea, but you can approach it the same way that a physician would. You are treating a medical condition. You're not treating a dental condition. So you need to approach it like a medical doctor would. When someone comes in experiencing, the signs and symptoms of obstructive sleep apnea, and they meet 5 out of the 8 qualifications that put them in a high risk category for having obstructive sleep apnea, your first comment is, okay, what we're gonna do, we're gonna go ahead and order up a sleep test, obviously if that's legal in your state, or it's like, okay, we're gonna give your doctor a call and we're gonna have them order up a sleep test, then you're going to come back, we're gonna go over that data together, and then we're gonna go over your treatment options because this is a serious condition that you need to deal with. There's no talk of deductibles, there's no talk of financial agreements. Traditionally, what dentists have done concerning finances and their business is they've done everything they can to protect themselves financially. This is a medical treatment that you're providing. You should not treat it like you would dentistry. You should treat it like a primary care physician would. There's no discussion of finances with the physician. The physician says, here's what we're gonna do. This is serious. Here's the next step. That's it. Stop talking about the finances. Start treating this like a medical condition. Now, some of you are worried. You're thinking, well, what if they don't pay? Okay, if you shift your mindset to that of a physician, the patient's mindset will shift as well. They worry about finances after they're done with treatment. It's like, well, I guess I hadn't met my deductible, I gotta pay this out of pocket. And if the patient says, oh, I absolutely can't afford this, then you ask, well, what can you afford? Like, what could you afford on a monthly basis? $200, $300? Okay, great. Yeah, we'll just finance that in-house, no worries. The percentage of people that will not pay you is so minuscule compared to the additional patients that are going to be moving forward with treatment and paying you because you're treating this like a medical condition rather than a dental procedure. Okay, the number of treatment cases that you're doing is going to far outweigh the number of people that are unwilling to pay you for your services. So again, stop acting like a dentist when it comes to dental sleep medicine. Start treating this and speaking to your patients as a medical care provider. And that is going to skyrocket the number of cases that you're doing on a monthly basis. I hope this was helpful. God bless.